Okay, welcome everybody. Thanks for coming. Today we've got a wonderful announcement, but I'm going to let others do that announcement. Welcome to Dr. Mphu Ramatlapeng. Sorry about that. I've been practicing, and then I got sidetracked this morning and was told, no, it's a different pronunciation. But let me introduce, I'm not going to give anything away at the moment, so let me introduce Bill Botel here to make all of the announcements and introduction of other guests. Okay. Welcome, Bill.
Thanks very much, Dawn, and to our colleagues Mphu Ramatlapeng, who is the Vice Chair of the Global Fund to fight AIDS, tuberculosis and malaria, a very distinguished fighter against AIDS in her own country in Lesotho, where until very recently Mphu was Minister for Health and is now Vice Chair of the Global Fund. We're also joined by Dr. Chris Steele-Perkins, who's the External Relations Director for the Global Fund, which is based in Geneva. I just want to very quickly tell you what the Global Fund is and it does. It was founded 10 years ago by the donor countries, or a very big group of countries, the donor countries, the recipient countries, because people knew, with the patronage of Kofi Annan, who was Secretary General of the United Nations, 10 years ago we had the treatments that people needed to survive, the difference between life and death. But what we didn't have 10 years ago was the money that would get those pills into the mouths of the people who needed them, particularly in Africa, but in many countries in the developing world, in Asia, South America, and in the Pacific. So this was a terrible scandal. Tens of millions of people were being infected, were suffering, were dying, early deaths, avoidable deaths because of the lack of these pills. And what was needed was a financing mechanism that could come into existence that could raise new funds from the rich countries and use those funds to support the application of treatments to people who needed them most urgently. And so 10 years ago the Global Fund came into existence in 2002, thanks to the G8 group of countries. And over 10 years of its existence, it's raised almost $30 billion US that has gone to the provision of antiretroviral treatments for people with HIV, that's gone to the provision of things like bed nets for people with, at risk of malaria, and for tuberculosis treatments. So it's $30 billion. And over those 10 years, there's been a dramatic increase in the number of people on treatments in the world. There's been a dramatic or a steady fall off of new infections with HIV, and bit by bit, because it took a long time to get to the great problem we have with HIV in the world, and it will take a long time to sort it out. But bit by bit, the application of that money is having a tremendous effect on the lives, a transformative effect on the lives of people in the developing world, in Africa, and particularly in our own region. Now, Pacific Friends of the Global Fund is one of many support groups for the Global Fund that exist in the developing countries, developed countries, the rich countries, a network of people who are really committed to the work of the Global Fund. In this country we have luminaries like Wendy McCarthy, who's the chair of Pacific Friends, Michael Kirby, Bill Whittaker, a range of people who've spent a long time in HIV and AIDS and who have really tried to get together to take the case to the Australian government, to the Australian political parties, to the Australian people, and say basically HIV is still here. Of course it's not the problem in our country that it was 20 years ago when it was a death sentence. Everybody in this country who needs treatment, who wants treatment, has access to treatment, and that makes the difference between life and death. So it goes a bit off the radar in Australia, but it's not off the radar in many countries in the world, and particularly in our region, in Papua New Guinea, where 50,000 people have HIV, and still not everybody who needs treatment in Papua New Guinea has easy access to treatment. And that's where the Global Fund comes in. That's where the tremendous work by AusAid comes in. and our ambassador for HIV/AIDS, Mr. Murray Proctor, is here today. And through Murray and AusAid, successive Australian governments have done tremendous work in trying to fund application of treatments for HIV in Papua New Guinea, in Timor, in Indonesia, and in other countries in our region. It's a big collective effort. We're very aware too that it's the NGOs in Australia who have been really hard working in trying to bring the treatment message and the prevention message to people in our region. And Don Baxter, who is the former head of the Australian Federation of AIDS Organisations and who is now on the board of the Global Fund, is here today. And through him we recognise the great work done by the Australian NGOs who are out there every day trying to help and assist people come to terms with the impact of HIV/AIDS and to try to get on top of it. So it's a great collective effort. It's really wonderful to be here today at this tremendous museum, institution, fashion and design, and to talk about the Access to Life project, a great collaboration between the Global Fund and Magnum Pictures that details and expounds and expands the work of the fund, and particularly the impact that these treatments have had on the lives of people in 9 countries that are in the original Access to Life exhibition. But very gratefully and thankfully there'll be a new component, completely all new component, for the exhibition that we shot in Papua New Guinea. It's about to be shot now, and it will form part of the exhibition that opens up here in November. But let me finish there. Let me warmly welcome the Vice Chair of the Global Fund, as I said, a tremendous fighter in Africa against HIV and AIDS, a doctor who knows on the ground what the impact of this disease has been and how important the efforts of institutions like the Global Fund and UNAIDS have been in transforming the lives of people in her country, in Africa and around the world. So, Dr. Mphu Ramatlapeng.
Thank you very much for that generous introduction. Mine is a very short message, is to really thank the Australian people, to thank you, Don, and this wonderful museum, which will allow us to showcase what has been happening around the work of the Global Fund. And Global Fund for TB, HIV/AIDS and Malaria, in conjunction with the Magnum Pictures, will be showing the pictures here in this museum, which will open towards the end of November, and will run through, I think, the culmination will be the World AIDS Day. This is a wonderful place to showcase the work that you have been doing, but most importantly, the work that all the fighters for HIV and AIDS who are here today have done and have contributed to the fight against these 3 diseases, but most importantly, HIV and AIDS. I'm very excited to see what will be coming out of the Papua New Guinea pictures, because truly, the pictures have told a story. And in many countries, when people have seen what has happened throughout the fight, what has happened when people take medication and treatment on time, people have been convinced, because it's not every one of us who can be on the ground to observe it. Don, thank you very much for agreeing to showcase our work in this wonderful setting, and thank you, everyone.
Well, thank you, Mphu, and thank you, Bill, for that wonderful articulation. And of course, for us at the museum, it's going to be an amazing experience, so we thank you for allowing us to have the Access to Life exhibition. We can continue, this enables us to continue the story of HIV/AIDS, and particularly the wonderful stories about our quilts. Now, if you look behind you, you'll see one of them. The Powerhouse has 97, and it's been a work of joy, love, inspiration that lots of volunteers, our curatorial team and conservation staff and many others have worked on it. And these opportunities keep cropping up for us to show the quilts, much to the delight of our curator. Last year we closed an exhibition on the 1980s, which we then told the story of HIV/AIDS and showcased the quilts. And this year we're going to open access of life, and it will feature some of our collection, but particularly the quilts. It's a very important story to keep going, to create that awareness and continue that awareness. And we're absolutely delighted that Papua New Guinea from our region is going to be included. We've experienced here over the last couple of years with our photography exhibitions that people are truly moved and engaged with photography and the images and the stories it can tell. So thank you all, and we're delighted to host it here at the Powerhouse Museum in Sydney. Thank you.